Hello, this is Dr. Arion. Today I'll be discussing one of the childhood problems that can lead to kidney failure if not taken care of. It's called posterior urethral valve. When our baby boys are born, it is important that the way they pass urine is paid attention to. The baby boy should be able to pass urine that projects far away from the child in a slightly big stream and projected on a straight line, a way that if you are around the baby, the urine can pour at you. However, some of them could occasionally have something that is blocking the urine from coming out, making the urine to come in drops. The child is passing urine and all you're seeing is drop of urine coming from the tip of his phallus. This is a sign that if seen, that child must be taken to a doctor and preferably a pediatric surgeon or a pediatric urologist to take a look and proper evaluation conducted. It may be because this child has what we call posterior urethral valve, which withholds urine in the bladder and predisposes the child to so many other complications, from having repeated urinary infections to developing stones in the bladder, thickening of the bladder, and ultimately the bladder failing. And in untreated cases, it can transmit pressure back to the kidney, leading to early kidney failure. Nowadays, it is worse so that children from even the labor room are put on diapers. So if you are not awakened to this possibility, you may never even check, and you may never even accidentally see the child pass urine, because the child is always on diaper and all you could get is that the diaper is wet and you change, not knowing that the wetness came from drops of urine over minutes or hours. So our mothers, dear parents, intentionally observe your child pass urine. In fact, until you confirm that your child is passing urine, you can intentionally let him without diaper to watch the urine and be sure that the stream is normal. Otherwise, have your doctor check and reassure you, because the consequences of missing this is grave. You wouldn't want your child to start having repeated urinary infections, unable to control urine passage when the bladder fails, and ultimately having to undergo kidney failure and need for kidney transplant. This, if is as a result of posterior urethral valve, is preventable by early treatment. So, as a mother, what are the things you need to watch out in your child to know if he has this posterior urethral valve or not? 1. Does his urine come in drops? Does he strain when passing urine? Is he always crying excessively when he's passing urine? Does the urine come in a very tiny stream, as if you are using a syringe with a needle at the tip to squeeze out water? These are signs that something may be blocking the urine. If any of this is seen, that child need to be immediately taken to a doctor for proper evaluation. So this is a wake-up call that for every baby boy born, in addition to all that should be checked, how he passes urine is important to avoid a preventable kidney failure from happening. Thank you. This is Dr. Arion, adding to health and social literacy.